Hello, this is our second week of demo chat. I am Jean. Today I will be by my own. Kim is having a live stream meal plan with the company now. So she will join me later on Thursday. Here's my brief intro. I have a PhD in biology and I am certified prediabetes prevention specialist and wellness coach. I have spent over 25 years in biomedical research and healthcare industry. Last week, we talked pandemics in the past century and had introduced the Spanish flu and the coronavirus. If you want to review the videos, please visit dymohealth.com. From this table, we see influenza flu virus and the coronavirus can bring big mortality to humans. Then you might ask, who is at high risk for this virus, especially for COVID-19 at this moment? A study captured the rates of COVID-19 hospitalizations among more than 334,000 people in England. This article, Overweight, Obesity, and the Risk of Hospitalization for COVID-19, a community-based cohort study of adults in the United Kingdom, published on September 1st, 2020, in the Proceedings of the National Academy of Sciences. It found that although the rate peaked in people with a BMI of 35 or greater, it began to rise as soon as someone tipped into the overweight category. Actually, many people do not realize if they belong to that category or not. There was a linear increase in the risk of COVID-19 with increasing BMI compared to normal weight. You can see this on this table. You might ask again, why does COVID-19 hurt overweight people so badly? From biology insights, obesity can cause impaired immunity. Obesity also causes chronic inflammation. Symptoms of chronic inflammation are like a body pain or chronic fatigue and insomnia, depression, anxiety, and mood disorders, diarrhea, or weight gain or weight loss, or frequent infections. Those are symptoms of chronic inflammation. Obesity can also cause blood that's prone to clot. So all of this can worsen COVID-19. This picture shows the mechanics why people with obesity are vulnerable to severe COVID-19. Fat in the abdomen pushes up on the diaphragm, causing that large muscle, which lies below the chest cavity, to impinge on the lungs and restrict airflow. This reduced lung volume leads to collapse of airways in the lower lobes of the lungs, which more blood arrives for oxygenation than in the upper lobes. If you are already starting with this mismatch, you are going to get worse faster from COVID-19. In the future, there might be other new viruses coming out. They can infect human respiratory system as well. Overweight people with with COPD, asthma, pneumonia, flu, colds, and congestive heart failure are also going to get worse faster, just like in the case of COVID-19. If you are obese, what kind of other diseases are linked to obesity? Extra weight makes you more likely to have high blood pressure and high cholesterol. Both of those conditions make heart disease or stroke more likely. Most people who have type 2 diabetes are overweight or obese. Cancers of the colon or breast cancer, kidney, are also linked to obesity. Gallbladder disease and gallstones are more common if you are overweight. Sleep apnea is a breathing condition that's linked to being overweight. Gout is more common in overweight people as well. So this list is not all inclusive. Not everyone who is obese has those problems. The risk rises if you have a family history of one of those conditions. Statistics shows 90% of hospitalized patients had one or more underlying conditions such as hypertension, obesity, chronic lung disease, diabetes, and cardiovascular disease. 3 diseases linked to obesity, such as heart disease, hypertension, and diabetes, are high risk to COVID-19. Losing weight has been shown to lower the risk from all these diseases. In US, 42% of the population is obese, according to CDC. So including stage 1 and stage 2 obesity, diabetes, COPD, heart disease, and chronic kidney disease, over 40% of US adults are at high risk to COVID-19. This is a big number. Prevent to get COVID-19, lose weight. So on this coming Thursday, Kim will provide some tips on weight control. Let's look for it. If you have any questions or comments, please write down. We will reply or talk about it at demo chat. Thank you for joining with me. Bye.